Where they're actually saying that the AQI of Mumbai is even worse than that of Delhi.
But what we have seen now, ki people have quit smoking and are vaping. And the issue with vaping is ki if you were smoking earlier, you would get out and smoke 2 or 3 cigarettes in a day. But with the vapes, I have seen they're having a vape anywhere and everywhere. It is smokeless, it is odorless. So as a result, they're in the washroom, they're in their office desk, they're still vaping away. Vaping is now more dangerous. And second thing is ki it is a banned substance. So we can't get it out of our memories. The days spent in the ICUs, the helplessness of the situation, where we have had patients who have never seen our faces because we were always in the PPE. The patients were clueless, families couldn't meet them. So that was a completely different experience. And when you're not resting, you're super stressed, you're not sleeping well, you're not eating well. So all the harmful products, metabolic products, their numbers increase. And that itself is going to harm your body. It's not only environmental pollution, it is also indoor pollution which aggravates the use of agarbattis or incense sticks, dhoop, loban, mosquito coils. They can also increase the indoor air pollution.
Welcome to yet another exciting episode of Seeds of Soul. Today, we are thrilled to welcome Dr. Kapil Salgia. He is a leading pulmonologist and the founder of foundation called Sprinkles Cancer Foundation, which he started in the memory of his late wife. We will be talking to him about all things related to lung health and health in general. So please join me in welcoming Dr. Salgia to Seeds of Soul. Thank you so much, Dr. Salgia. Thank you
Thank
for.
you for having me over.
It's a true pleasure to have a leading doctor like yourself to come to our podcast and talk about health. So, in a metropolitan city like that of Delhi, Mumbai, pollution is a major concern. Do you think that it has actually deteriorated our quality of life as a population as compared to interior countries? What is your take on that?
So, significantly, the air pollution levels have gone bad. Earlier, we used to just hear about Delhi. Even Bombay, in the past couple of years, in the winter season, it has become very difficult. And it has definitely impacted our respiratory cases.
Where they're actually saying that the AQI of Mumbai is even worse than that of Delhi in some. I
Yes, so
remember.
last year it was. I mean,
Correct.
we could really see it, and it could see it in the field as well. So it has definitely impacted the respiratory health. If you were to see, almost every second person is coughing. A lot of people have a cough which is going on for a longer period of time. So many of them are requiring inhalers or nebulizations. So it has impacted respiratory health in a big way. Normally, even in Delhi, when patients are in winter season, the number of emergency visits, hospitalizations significantly increase in people who have asthma, chronic bronchitis, or underlying heart diseases, elderly people. So definitely it is there.
Any conversation with a pulmonologist will be incomplete if I don't talk about COVID and your experience of dealing with that situation in this thing. How was it for you?
So, COVID. So it's something, I guess, which you experience once in a lifetime. So we can't get it out of our memories. The days spent in the ICUs, the helplessness of the situation, where we have had patients who have never seen our faces because we were always in the PPE. Patients were in the hospital, and for the first wave, no one knew what was happening. The patients were clueless, families couldn't meet them. So that was a completely different experience. But I guess by the second and the third wave, things settled down, the vaccinations helped. And I guess now it has become like a normal viral thing. People test for it, people don't test for it. Normally, it's self limiting in a couple of days. Yeah, but those were trying times. It
Okay.
taught us a lot.
Taught us a lot, both about our our country, our situation, but mostly I think it taught a lot about our own resilience, right? About how we came together as a community to help support each other. There were so many, cases where the kindness of humanity shone through. Are there any such cases that positive cases that you came across during your time?
So, the entire fight at that point of time was for food. And all building apps, everyone was throwing towards that. Everyone was working towards how to get vegetables, how to get that. So I guess it got the entire community together. I don't think so. People interacted with each other that often before this thing happened. But with those couple of months of COVID, helping each
Especially in
other,
the first wave.
first wave, because you were isolated from everyone else, people were only interacting with building people. I guess the bond, people realized what neighbors meant. I guess the mutual respect. There were people who were elderly. The younger generation has taken care of their food, taken care because their families couldn't come and take care of them because no one was allowed to move. So I guess it was a trying time medically for a lot of us, for a lot of patients who went through that. But at the same time, the different aspects of humanity, it opened up. And the most important thing, people started accepting that, we should wear a mask. And I guess that is one of the most important thing that we advise to our patients. It's a simple mask which can definitely help you to fight pollution or to fight respiratory tract infections. Kindly wear your mask, especially in crowded places, if you suffer from an underlying respiratory condition.
Correct. So after COVID, there has been a lot of rise in cases of diabetes and heart disorders. Do you think that COVID vaccinations had anything to do with that?
So, if you are going to take my view on that, the vaccinations have helped so many people. If you were to see the statistics, the mortality in phase 1, mortality in phase 2, and after that, it just became like a routine infection. People got admitted at times just because out of fear, but they didn't really have a bad outcome. And a lot of them did well. So, vaccines definitely helped. There have been few sporadic cases of certain issues which might have happened, but I don't know how much of it you can attribute everything to vaccines. At that point of time, it saved lives and it continues to save lives. At least those 2 rounds or 3 rounds of vaccination that we had. So I guess it would not be right to put the onus of everything that goes wrong to your health to COVID. Yes, we did have few challenges, but not all. Our lifestyles are more contributory to development of diabetes, hypertension, and cardiac. So, having said that, there might have been few incidences of certain COVID vaccine related side effects,
Hmm.
but not something where you would tell people not to take.
Yeah.
I guess all of us who took it
Yeah.
definitely benefited.
So, speaking of lifestyle, amongst the younger generation, I'm seeing this case of rising use of vaping.
Yes.
Okay, as a pulmonologist, what is your take on that? I mean, and I've read reports where they say that it is even worse than smoking. I would love to hear your insights on that.
So, funnily, we had a trick question when we were doing our residency. Which form of smoking is the safest? Whether it is a BD, whether it is a hookah, whether it is a cigarette. And the reply was no form. But what we have seen now, ki people have quit smoking and are vaping. And the issue with vaping is ki if you were smoking earlier, you would get out and smoke 2 or 3 cigarettes in a day. But with the vapes, I have seen they're having a vape anywhere and everywhere. It is smokeless, it is odorless. So as a result, they're in the washroom, they're in their office desk, they're still vaping away. So I guess, and it is a chemical which is going into your body. Don't even have too much of data to say ki what are the harmful effects of that. So I guess vaping is now more dangerous. And second thing is ki it is a banned substance. So now you do not know the quality of vapes. Abroad, at least, there is some, I guess, regulations to vaping. But here, you are getting it from the gray market. You don't know the quality. And we have had cases of vaping induced lung injuries, vaping induced pneumothoraces. So, all complications that you would see because of smoking, we have seen with vaping as well. So, another vicious thing that we have encountered is the use of hookah. It is socially acceptable, and I guess people across all generations are doing it. Socially, it's an acceptable norm. In weddings, people have started having it. So, it's another thing where people don't realize
Correct.
it is a form of smoking. You are inhaling carbon, you're inhaling over the coal. There is tobacco. Even if it's non-tobacco use, there are chemicals which are going into your lungs.
Correct.
So all these are going to have an impact.
Mm.
So, now it is an integral part. When I ask history, I just don't ask history of smoking. I am very particular about vaping
Okay.
and hookah smoking, because now people who are from a very uh, reserved spaces also, but they are doing hookah. People
Okay.
don't drink, people don't do anything else, but they do hookah. So I guess these are the newer things, challenges, due to which we do see increase in airway disorders like asthma or chronic bronchitis.
Okay. So, doctor, you were talking about your foundation. I would love that if you could shed some light on it as to how you came about starting it and what all work your foundation has done thus far.
So the seeds of starting the foundation were laid by my late wife, Ragini, who passed away due to a very rare tumor. And it was during those 4 or 5 years that we were struggling to treat her. We traveled all across, got opinions from all across. Unfortunately, we lost. But during the course of the disease, we realized there are so many people who may not be able to reach the phase of getting their near and dear ones treated.
Sure.
So, with this initiative, seeing those kids in Tata Memorial,
Mm.
I guess the seeds were sowed that we should try to give back to the community. We should try to do in our small way something for cancer. And that's how the Sprinkles Cancer Care Foundation started.
Okay.
The name was given by her 6 days before she passed away, when she came to home from the hospital, knowing that it would not, that is the end. But I guess from that time onwards, we have been able to reach out to 450 patients as of now.
Wow.
We've donated more than 40, 50 lakhs, and it has been, I've been thankful to families, friends, and so many people who have come from nowhere, whom I didn't know. They heard about it, they have donated towards it.
Okay.
So, as a foundation, we provide financial assistance to all kinds of cancer patients across the city in our small way, whatever we can. We provide free PET scans. We
Okay.
also look at providing second opinions for cancer patients with other medical oncologists for group of patients who may require that but can't afford it.
Mm.
And plan is in future to move towards educating cancer kids and maybe more avenues for cancer awareness wherever we can reach out.
We will definitely work with you to spread the good word of Sprinkles Foundation, and the details for making donations to the foundation will be mentioned in the captions below. So, coming back to the topic of lung health care, uh, there are a lot of misinformation that is out there. What is the worst case that you have heard of? What is the worst such thing that you have heard of?
So I would like to talk about asthma.
Yeah.
Asthma is a disease of the airways where mostly due to allergic or hereditary triggers, you have a family history, and these patients keep on getting recurrent attacks of cough, breathlessness, and inhalers are the mainstay of treatment. We talk to the patients and the families about the use of inhalers, but there is an inherent resistance to starting inhalers. So a lot of times they know what the problem is. They are getting nebulizations done in emergency visits, but they avoid the use of inhalers. And as a result, a simple thing which could have been managed. Sometimes they get hospitalized.
Aggravated.
It gets aggravated. It affects their quality of life. Especially in kids, parents are not wanting to accept the diagnosis of asthma, or their kid will need to take inhalers. As a result, what happens ki they are not able to optimize their potential. They avoid taking part in sports. They lose days at school, and they're constantly coughing away. So what I would like to say is, it's a disease which is there rampant. Increasing air pollution levels are contributing to increase in the number of cases of asthma across all age groups, definitely in the pediatric group. Inhalers definitely make an important change, or it's an important intervention which improves their quality of life. So I tell my patients and their parents, or even the elderly age group, start using the inhaler. Let it improve the quality of life. You see what the response is. And once you are convinced about the response, kindly continue that.
So I'm going to ask a controversial question next. When it comes to children's health, there is a rise amongst parents to actually go in for an Ayurvedic solution or a homeopathic. Is it a 0-1 game? Is it like that one treatment is better than the others? And what are your thoughts on it?
So I come from a field of allopathy, so I know what I'm talking about. But at the same time, I cannot belittle any other thing. So there is Ayurveda, there is homeopathy, which works for certain kinds of illnesses. But knowing what works and not taking it is not right. Okay. So everyone has their own beliefs, and if that is helping them, that's fine. So if my patients ask me, doc, I'm taking Ayurvedic treatment, I am taking homeopathic treatment, so I tell them, you know the person who's giving it to you, you can continue. But this is what I feel for management of asthma. This is, I definitely know which is going to work.
Okay. Because there is a certain pushback against allopathic medicine is because they feel that these are steroid based medications and they might offer short term benefits, but Ayurvedic and homeopathic offers long term benefits.
So,
I'm sure you must have
yeah,
heard
so
this before.
steroids. But you need to realize, like in airway disorders,
Correct.
like asthma, it's the airway inflammation, the sujan in the airways.
Hanji.
The only way to tackle it is to use inhaled steroids. Now, these inhaled steroids are in such a minuscule dose that it doesn't enter into your body also. It just works on the airways and has its effect. It prevents further attacks and helps in improving your lung functions along with a bronchodilator.
Correct.
So, I guess it is a wrong understanding of thinking it is steroids and they're harmful. So, yes, if you are giving them oral steroids again and again, oral steroids on long term use definitely have come with a lot of side effects. But inhaled steroids that we use for asthma, I guess they're pretty safe to use. I am using it for kids who are 1-2 years of age. We are using it for elderly people, and we normally don't come across any severe steroid related side effects with inhaled steroids. But asthma per se, at times when you are in an emergency, you have an exacerbation, you do need to use steroids.
Okay. And you are saying that in certain moderation, steroids are perfectly used, and if it is given obviously under a physician's
So
guidance.
it has to be under a physician care. And what I'm talking about is of inhaled steroids. Like the pump that you get, it contains an inhaled steroid, which is ideally recommended for all patients with asthma to improve their lung quality. Yeah.
So, coming back to the urban population, and we were talking about air quality earlier and how it has become deteriorated over the last couple of decades. Do you think that it is actually, harming the health of our children? I mean,
Definitely. Definitely. Because it is impacting them. The number of people who are coming to us, or my colleagues who are pediatricians, with recurrent respiratory tract infections is very high. So initially, once or twice, it gets treated as an infection. But if something is coming again and again, so it's just not an infection, it is an airway inflammation. So yes, it has significantly impacted the pediatric group. And when I talk about pollution, it is just not the pediatric group, the vulnerable group. So if someone has an inherent underlying lung disease, someone who has COPD, asthma, or interstitial lung disease, lung fibrosis, they also their health gets affected because of pollution. Elderly group of people who have cardiac diseases, diabetes, they are also impacted due to this air pollution. Their visits to hospitals, emergency room visits, ICU admissions definitely has increased because of air pollution, especially in the winter months. See, Delhi,
Yeah.
winter months, Delhi, all hospitals are flooded,
Flooded.
and it is only with
Absolutely.
respiratory tract infections
Correct, correct.
and pneumonias.
That happens. So, doctor, we spoke about the rise of air pollution related diseases in India. Do you think our government is doing enough to address this growing issue?
So, definitely, the government has taken initiatives because air pollution is a serious issue. It is the sixth leading cause of death in our country.
Wow.
So, it is being termed as a silent killer.
Correct.
And especially with the debacle in Delhi with the rising amount of pollution and all other countries, especially in winter season,
Correct.
crop burning, which have contributed to this. The government has taken cognizance of that, and I guess they have introduced a lot of policies, like the introduction of LPG gases for indoor house cooking, because biomass fuel is the commonest source of pollution in the rural areas.
Correct.
Introduction of hybrid cars, electric vehicles, subsidies on electric vehicles, CNG use, all those things are going to definitely make an impact in the coming decade.
Correct. Correct.
There are rules which have been incorporated. I guess implementation strictly is the need of the hour.
Very strict implementation.
Yes. And I feel it is just not the government, no? It's all of us who have to play an important role.
Correct.
Like people who are running their industries. So it has to be, they have to be responsible.
Correct.
Okay, let me put in a little more money and try to see that I don't pollute the environment.
Correct.
People who are running chemical industries, they need to see that they don't let that effluent material into the rivers, which affects the marine life. We are moving into renewable energy, solar panels, wind energy. So that itself goes to show that there is an initiative to control air pollution.
So we were speaking about government policies, and there is obviously a global concern regarding global warming. So do you think India should focus on improving or implementation of improving air quality policies, or should we focus on global warming policies, or both go hand in hand? What is your opinion on it?
Global warming is a reality. No? I guess if you have seen in the past 5 years, our summers are hotter,
Correct.
rains have gone down, or you get unseasonal rains.
Correct.
Winters are not cold anywhere.
Yeah.
Like especially even places like Canada, which were snow laden till March,
Correct.
this time did not get enough of snow. Glaciers are melting. So global warming is a big concern because now seasons are changing. So definitely all of us need to work towards it. So all governments need to work towards it. So internationally, all governments, including ours, need to work about whatever steps they can take so as to avoid or take care of the global warming. But at the same time, local factors need to be controlled. And it is a very dynamic situation. What is the pollution in Maharashtra? What could it be in Gujarat? What could be in another state? So I guess local implementation needs to be more focused to the needs and the pollutants in that area.
And speaking of that, do you think that rural areas actually has a better air quality as compared to urban?
Uh, technically speaking, I'm like this, my opinion. Yes, the pollution levels might be slightly lesser because that's why we go to the villages, to experience the cleaner air. But in villages, there is a lot of crop burning which happens, which adds to the pollution. They use a lot of indoor biomass fuel, wood chula for cooking, gobar gas, dung, and everything, which contributes to a lot of indoor pollution. The number of cars in villages has also increased now. So there were earlier used to go to a village, there used to be hardly 4 bikes or 4 cars. Now there every household has a car. Infrastructure, building, construction activities have increased. So I guess rural parts of country also are getting polluted. So maybe urban areas are more polluted, but I would not say rural are free of pollution. The fertilizers, the pesticides, everything is contributory. So the rural pollution is definitely increasing, might be lesser than the urban. That's it.
Do you think nutrition and lung health play a crucial role? Because with the rise of processed foods and fast food in the recent times, do you think that has had any impact on deteriorating lung health?
So when we talk about asthma, sometimes in certain groups of patients, having a lot of processed foods or foods with artificial colors definitely can aggravate their asthma. Obesity or childhood obesity or even adults obesity is a gift of instant food, processed food, and poor healthy eating habits. So I also deal with sleep. Sleep apnea is a growing concern with the number of people who are obese, number of people who have an undiagnosed sleep apnea.
Could you tell what sleep apnea is for our audience, for a layperson to know?
Yeah. So, sleep apnea is a disorder where people, the common symptoms that you would get is snoring. They snore a lot. Sometimes while sleeping, they stop breathing completely and they suddenly awaken. They get apneic episode, they get startled and wake up. The entire day, they always feel lethargic, tired, want to sleep. They are irritable. They don't, they can't concentrate. They need to get up again and again in the night to pass urine. So these are common manifestations. Continuous acidity. These are few symptoms of sleep apnea. Apart from that, diabetes which is not getting controlled, blood pressure which is not getting controlled, are also evaluated for underlying sleep apnea. It increases your risk to develop a stroke, that is paralysis, develop heart attacks, develop all other kinds of metabolic disorders. So obesity, and the commonest cause for obesity, I guess, is easy availability of instant processed food.
Correct.
Also, what we have noticed, the intake of proteins has gone down. So we are eating all the time. We are eating a lot of carbs. We are eating a lot of chips. We are eating a lot of colas, ice creams. But the protein intake has gone down.
Correct.
And deficiency of protein in our diet can definitely uh, predispose to development of tuberculosis. So if you have a malnourished diet, you're undernourished, then chances of you getting tuberculosis goes up because we are inherently a country which is endemic for TB.
Okay.
So if you are not eating well, not sleeping well, not having nutritious food intake, and you come across people who have open coughs or something, then tuberculosis.
So how does tuberculosis happen? I mean,
So there are two ways. So one, you get exposed to someone who has got tuberculosis and he coughs in your face or something, and the tubercular bacilli goes into your body. And whenever your immunity shuts down, maybe due to diabetes, maybe due to lack of sleep, poor nutrition, I guess at that point of time, TB can get activated. Also, you may get exposed to a tubercular bacilli at some point of time in your life, and whenever your immunity goes down, that's the time you can get manifestations of tuberculosis as a disease.
correct. So you were mentioning earlier that protein as a country, I completely agree with you that we are a highly protein deficient country. Now, but also we are largely vegetarians, and finding good sources of quality vegetarian protein sources are actually hard to come by. So, do you think that is a reason for our rising lung problems or the thing? So,
No, I don't think so. That would be a right thing to say, because in vegetarians also you have all kinds of dals, pulses, chola, chana, rajma, everything which is available. You have
correct.
tofu, you have soya bean, you have paneer,
Hmm.
you have cheese. So we have a lot of varieties of proteins available.
Correct.
The
It is just
problem,
about making the right
yes, the
choices.
problem is we are not having it.
Hmm.
I'm like, I see the kids right now, they skip lunch, they skip dinner,
Hmm.
they don't have dals, so
Hmm.
they are on a burger or a pizza or a sandwich. So I guess for vegetarians, there are a lot of options in vegetarians for proteins. It's
Hmm.
just that we need to consume them, have a balanced meal
Correct.
out of
Correct.
it.
Cough and cold and common flu have become a norm when okay, cough and cold and sorry, cough and cold and common flu have become a norm whenever there is a change in the season. Correct. So, as a doctor, are there any precautionary measures that you would like to advise to our viewers?
So when you talk about it as a pediatric aspect, so normally when the kids grow, they start going to a school, they are going to get exposed to various triggers
Hmm.
and the body is going to mount a response.
Correct.
So that is the time when, the first or the second year of school for some kids can be very challenging. So at that point of time, getting recurrent attacks of flu, running nose, sneezing happens. But most of them settle down by 5 years of age.
Hmm.
Now, if there is a family history of asthma,
Hmm.
then in that group, asthma can get aggravated.
Hmm.
So I would say let your kids play,
Hmm.
let them get intermingle with a lot more kids,
Correct.
let them go to the playgrounds,
Hmm.
don't isolate them.
Hmm.
Because the longer you isolate them,
Hmm.
they are not going to get exposed to more triggers.
Hmm.
So their body immunity is not going to build up.
Okay.
So I guess a kid should be allowed to play,
Hmm.
interact with as many people.
Hmm.
Once that exposure happens, the body will itself develop its immunity.
Correct.
Definitely, what as parents they can do is ensure that the kids get a balanced nutrition.
Hmm.
So there are nuts, there is milk, there is vegetables, and everything which is balanced.
Correct.
All kinds of vitamins in their diet,
Hmm.
and they sleep well.
Hmm.
Those are few things that we can take. And in case if there is a family history of asthma and your kid is recurrently falling sick,
Hmm.
some may require some inhalers for some point of time.
Hmm.
But normally by 5 to 7 years of age, a lot of these kids do outgrow it.
Correct. So, this is an interesting point that you brought across, Doctor, about the fact that, we should actually allow the children to intermingle. Of recent, there has been a lot of scare that has been, put in our minds by the big pharma about, that you should be scared from bacterias, and therefore, a lot of parents actually keep their homes sterile, very very clean, and very very bacteria or any kind of dust free, because they are scared that their child might fall sick. Do you think that actually it works counterintuitively, and in as the child grows up, you're actually weakening the immune system? Is that where how
Yeah,
would you like to
so
say that
so
to
I would say the more you are exposed to allergens
correct.
or environmental factors, definitely your body is going to mount a response, develop an immunity to that. So if you're going to socially isolate and not let them get exposed to anything, at some point of time, whenever they get exposed, they are going to have an issue. So when I say that, definitely, if there's a lot of smoke around, there's a lot of pollution around, there's something going on, you avoid them going out. But on a routine day, I guess all of us need to get exposed, and body, it's a uh, what I would say, natural responses of body are so amazing that they take care of themselves. So I would not believe in socially isolating. Okay, if there is a problem, there is a issue with a kid who suffers from certain illnesses where his immunity is a challenge and they need to be taken care of, definitely as advised by the physician. But all in all, I feel all these kids need to get out. They need to play in an outdoor environment, play in the dust, play football, play cricket, and they naturally build up their immunity. That's what is very important.
Okay. So lack of sleep amongst young adults, is that causing a lot of health issues, especially respiratory problems?
So I would not say lack of sleep is causing respiratory issues,
Hmm.
but lack of sleep on the whole is definitely affecting everyone.
Correct.
So when you are lack of sleep, your body doesn't get rested. So there are release of all kinds of enzymes in the body. So there are increase in the chances of your immunity going down. So
Hmm.
you can catch secondary infections.
Hmm.
Over a period of time, development of diabetes, hypertension in the age group of 35-40 increases. The
Hmm.
stress levels increase
Hmm.
because you're not sleeping at all, or you're just
Correct.
sleeping 4 or 5 hours in a day.
Hmm.
So I would say 7 to 8 hours of sleep is something which
Is
every
very.
young person should definitely try to manage.
Hmm.
And if people more than 40 can get it, then it's a luxury. Yeah, so whenever the stress increases, immunity goes down.
So
And
how does stress actually impact immunity? If you could actually put it in black and white for us.
so your body requires rest. And when you're not resting,
Hmm.
you're super stressed, you're not sleeping well, you're not eating well.
Hmm.
So all the harmful products, metabolic products, their numbers increase.
Correct.
And that itself is going to harm your body. So that's why the elder generation, if you see, they
Hmm.
used to sleep by 9, 10. They used to wake up at 4, 5. They used to get their 8 hours of sleep.
Hmm.
And definitely most of them have lived a very healthy lifestyle.
Correct. Correct.
And most of us are right now, even when we go off to sleep, we are on our WhatsApp, we are onto social media. So even if you try to go out to sleep at 11, you actually land up sleeping at 1.
Hmm.
Because the more you are seeing that, the more active you become. So that even if you're getting the sleep onset, it goes away at that point of time.
Correct.
So adequate sleep, I guess now if you are going to listen to anyone or listen to any health consultant also or a nutritionist, they always talk about adequate sleep. So we are going to the entire round circle and coming back to the basic that is required: proper nutrition, exercise in your day to day life, meditation to de stress yourself, and adequate sleep of almost 7 to 8 hours. I guess that will take care of a lot of your health issues, the lifestyle disorders.
Correct. Correct. So, during COVID, did you think that a lot of secondary issues actually created problems? Like, for example, comorbidities, they created a lot of problem for your patients, and that led to
So,
fatalities.
so the first wave, I guess we lost a lot of people who were elderly with multiple comorbidities. The second wave, we lost a lot of younger crowd. So for that, we couldn't explain. With elderly, we knew there were multiple comorbidities, but in the second wave, I guess we lost a lot of people who were younger age group. So I don't know whether COVID affected whom and all, but it did affect almost everyone. Healthy people also got affected, lost their lives. Even unhealthy people lost their lives. But I would say one important aspect that we learned out of COVID is the number of people exercising, joining a gym, or working out, or taking care of their health, because it got incorporated as a part of their lifestyle then. And I guess that is a positive takeaway from COVID.
Correct. So, there have been actually a lot of alarm bells that have rung after COVID also, of certain new viruses that have made an appearance. What is your take on that? Should the alarm bells be ringing? And
So, at some point of time, we are going to get exposed to different viral infections. And I guess we need to take our precautions. We need to see how we can prevent ourselves from that. But your entire life, you can't be scared that there will be a viral infection and I will not venture out of my house.
yeah.
So it wouldn't work that way. So there is going to be some virus or the other. So and the only way, even right now, if you see, your immunity fights it off. If you go to your physician, most of the time, what would he say? Take a plain paracetamol and rest it out.
Correct.
It's the forced rest which basically makes you get better. So I guess again coming back to this thing, so if you have a good immune response and if you are conscious about your diet, your exercise and your sleep, maybe your body will be able to fight off most of the viral infections. For some, there are drugs available, but I don't think so. We have drugs available for each and every virus.
It's not.
It's not there. So I guess most of the times it is just resting it out, let it run its course, and most of us do get better.
Yes. So thank you so much, doctor. It has been a true pleasure to have you here and speak to us about all matters related to health. Is there any parting note that you would like to share with our audience?
So a few things that I normally tell my patients now because of the rising trends of air pollution. So if it's not only environmental pollution, it is also indoor pollution which aggravates, especially for our asthma patients and all. So use of agarbattis or incense sticks, use of dhoop, loban, mosquito coils, they can also increase the indoor air pollution. Use of wood for burning, use of dung for burning, all those things contribute to indoor fuels. So those are things that we can definitely do away with. Second is, if you feel you are allergic and you are going to a place which is going to be dusty, wear a simple mask. That is going to be able to take care of your pollution related issues. If you suffer from multiple comorbidities or poor lung health, that is your asthmatic, having lung fibrosis, cardiac issues, wear a mask when you are in a public gathering, like you're traveling by a train, traveling by a flight, at the airport, in a mall. So it's a simple intervention that COVID has taught us. Just wear a mask. At least it can prevent certain amounts of unexpected infections in you. So that is very important. And definitely in the at-risk group, use of vaccinations for preventing respiratory tract infections is very common. So you have the flu vaccines which are available, which we advise for our patients once in a year. You have certain pneumonia vaccines for the at-risk group. So all those things are important.
Correct.
So my thing would be concentrate on your diet, sleep, and exercise. If you have an underlying disorder, meet your physician, get treated under supervision. And I guess we can't stop living
Correct.
and we have to do our own bit. How I can reduce my contribution to air pollution.
Correct.
It starts off from there.
Correct. So, on that, thank you so much. It was an honor and a pleasure to have you. And
you so
yes,
much.
thank you.